This video covers thyroid gland and its function, types of thyroid disease, causes of thyroid disease, symptoms, treatment, dosage, side effects, natural remedies, thyroid and pregnancy, and last, foods for thyroid disease. If you want to go to a particular topic, you may scroll down to the description box and click the concerned topic. So we'll go ahead for the very first one, thyroid gland and its function. The thyroid gland is a butterfly shaped organ base of your neck and just below your Adam's apple. It is composed of two lobes, one of the right and the other is on left. Women have a larger size of thyroid gland comparison to men. Thyroid hormones are primarily responsible for regulation of metabolism of your body by producing T3 and T4 hormones. Your metabolic rate shows how quickly you process the food, how fast your heart beats, how much heat your body generates, and even how quickly you can think. The production of thyroid hormone is controlled by another hormone called thyroid stimulating hormone, that is called TSH. TSH hormones are produced by pituitary gland situated below the brain. The level of thyroid hormone is sensed, and when there are less number of thyroid hormones, pituitary gland secretes TSH. TSH provides a signal to the thyroid gland, and thyroid glands starts producing more number of thyroid hormones. In the same way, when there are more number of thyroid hormones, pituitary reduces the TSH, and so the thyroid gland reduces the production of thyroid hormones. T3 is called triiodothyronine and T4 is called tetraiodothyroxine. T3 is so named because it contains 3 atoms of iodine per molecule, and T4 contains 4 atoms of iodine per molecule. T4 is actually less active than T3 hormone, but we take synthetic T4 hormones in form of the tablets because most of the T3 hormones in our body can be generated by T4. When T4 hormones come into contact in some organs, as in liver, they give up an iodine atom to interact, and as T4 loses the iodine atom, it becomes T3. So what are the normal values of T3, T4 and TSH? T3 is having the normal range from 0.60 to 1.80. T4 is 4.5 to 10.9 and TSH is 0.35 to 5.5. As you can see here. Please note that these values are not for the pregnant woman. Now we will talk about the types of thyroid diseases. The first one is hypothyroid. When thyroid gland produces less number of thyroid hormones, it is called hypothyroidism. The second one is hyperthyroidism. When thyroid gland produces more number of thyroid hormones, it is called hyperthyroidism. And last one is goiter. When there are multiple nodules and swelling of the thyroid gland, it is called goiter. So what are the causes of thyroid diseases? The main cause of hypothyroidism is an autoimmune condition in which the body produces antibodies. These antibodies attack on thyroid gland and destroy it. This condition is called hashimoto disease. Sometimes clinical removal of thyroid gland may cause hypothyroidism. Some other reasons as problems in pituitary gland, problems in hypothalamus and iodine deficiency may also cause hypothyroidism. In case of congenital hypothyroidism, newborn baby has hypothyroid disease. Now we will talk about the causes of hyperthyroidism. The main cause of hyperthyroidism is Graves' disease, in which the immune system produces antibodies that excites the entire thyroid gland, and the thyroid gland produces more hormone than required. Scientists are not sure why the body produces antibodies against itself. Some think a virus or bacteria might trigger the response, while others believe a genetic flaw may be involved. Most likely, autoimmune diseases result from more than one factor. There are several causes of goiter as autoimmune disease, benign disease, malignant disease, infection and iodine deficiency. When there is goiter, the patient has less space in food pipe to pass the food or water, and so feeling troubling in swallowing the food or water. The patient may feel problem in breathing also. So now what are the symptoms of thyroid problems? Symptom of hyperthyroidism. Hyperthyroidism basically increases the metabolism. So you will find suddenly weight loss, rapid heartbeat, nervousness or anxiety, straightening, changes in menstrual pattern, increased sensitivity to heat, frequent bowel movement, fatigue or the muscle weakness, difficulty in sleeping, or an enlarged thyroid gland. Now we'll talk about the symptoms of hypothyroidism. Hypothyroidism basically decreases the metabolism. So you will find weight gain, slow heart rate, fatigue, increased sensitivity to cold, constipation, dry skin, hair loss, and depression. It is not necessary that you should get all the symptoms. It may be there only one or two symptoms you may be there. Now we'll talk about the treatment. Level of thyroid hormones can be tested with the help of one easy blood test. If you are diagnosed with a hypothyroidism, you may be prescribed a hormone replacement drug that is to be taken daily for the rest of your life. If you are diagnosed with hyperthyroidism, you may be treated with drug therapy, surgery, or radioactive therapy. Drug therapy prevents the production of thyroid hormones. In surgery and radioactive therapy, the size of thyroid gland is reduced and so the production of T4 hormones is reduced. In radioactive iodine therapy, patient is ingested the radioiodine and over the course of weeks or months, it destroys some part of the thyroid gland. Surgical as well as radioiodine method are not exact method to cure the hypothyroidism. It has been noticed that many patients ends up with an underactive thyroid, which is then regulated through medication. Now what about the goiter? Goiter can be treated by surgery or radioactive therapy. The doses are very important. Supplements, foods or other medications can alter the effectiveness of the tablets. So they should be taken with water on an empty stomach and you should avoid eating for 30 minutes afterwards. What are the side effects? Some people has noticed the side effects as chest pain, diarrhea, headaches, sweating and vomiting. It may be there, people will not get the side effects. There are some natural remedies for thyroid also, though in allopathy it is told that it cannot be cured, but definitely there are natural remedies are available. The very first one is Ujjayi Pranayama, Kapalbhati Asana, Sarvangasana and Halasana. Now one small topic we will take, that is the thyroid and the pregnancy. If a woman wants pregnancy, it's important to check levels of thyroid hormones. If you are having thyroid problem, there are less chances of getting pregnant. If you get pregnancy also, there are chances of miscarriage. There are chances of an underdeveloped baby, maybe physically or mentally. So it's very important to treat your thyroid problem first before getting pregnancy. If pregnancy has been already achieved, you will be required special attention to make thyroid levels in control during the whole pregnancy period. Now we will talk about diet for hypothyroidism disease. What you should eat. The thing is whole grains like brown rice and bulgur, that is called dalia also, oats and etc. You should eat cherries, you should eat sweet potatoes and tomatoes also. There are some beans you should take, fish you may take, and especially you should take the nuts like almond, cashew, walnut and Brazil nuts. If you could find Brazil nuts, these are very advantageous than other nuts. And you should take yogurt, curd, cottage cheese. What you should avoid in case of hypothyroidism. The very first one is soy products like soy milk, soy sauce, soybean paste, tempeh, that is called a soy cake, or the tofu. You should also avoid broccoli, cabbage, cauliflower and kale. You should also avoid gluten that is found in the processed foods from the wheat and barley and rye. You should avoid fatty foods like French fries, chips, fried chicken, butter. You should definitely avoid some sugar products, or you should limit. And definitely at the last, you should avoid alcohol and caffeine. Now we will talk about diet for hyperthyroidism disease. What you should eat in the hyperthyroidism. You should eat omega-3 fatty acids as nuts, almonds, cashew, walnut, Brazil nuts. As I told, if you get Brazil nuts, that are much better. You can take the olive oil and the flaxseed oil. Flaxseed oil are very important, and you should take fish also. You should take dairy products like milk, cheese, and yogurt. Definitely you should take. Now broccoli, cauliflower, and kale. These three things you should eat in case of hyperthyroidism. But in case of hypothyroidism, as I told earlier, you should avoid these things. Now berries like amla you can take in this case. What you should avoid in case of hyperthyroidism is seaweed, kelp, salt. Salt you should avoid, processed food and fried food. White food, that is called maida, also you should avoid, and sugary food you should avoid, sugar foods. Gluten that's found in processed food like wheat, barley or rye. Soy products definitely you should avoid, like soy milk, soy sauce, soybean paste, tofu, soy cake or the tofu. You should also avoid corn. You should avoid hydrogenated vegetable oil like crackers, onion rings, chips, donuts, and definitely you should avoid the caffeine also. I hope this video is helpful for you. You may subscribe this channel for upcoming health related videos. You can see some other videos here. I hope these videos will also be useful for you. If you like this video, please thumbs up and share it. If you have any question, just write down in the comment box. Meet you soon with another health topic. Till then, goodbye.